today we're going to focus on why your hamstrings might be tight. So if that's an issue or something that you're experiencing, we're going to address two common, or maybe not quite common, but two reasons why that could be happening. We're going to stay away from talking about the musculature component that your muscles actually need to be lengthened, and we're going to focus, number one, on the neurological piece. Think of your body, your central nervous system, everything's connected to your brain, and your brain and muscles are going to send signals to and from each other. And sometimes this is almost like your body acting in a protective measure, where maybe you move really poorly, you hit bad positions in your lifts, your technique is kind of off, or maybe just outside the gym we're moving poorly, and your body is making that muscle tight to protect itself, to prevent some sort of injury from coming in the future. So that is one thing where if you're just always going to do where you're laying on your back and doing a static hamstring stretch, you might not notice any progress, because this relates more to movement and how we're moving and needing to learn how to move better. The second, where we're going to spend a little more time, is for those of us who have what we refer to as an anterior pelvic tilt. That's just a simple way, or a long way of saying where our pelvis is tilted forward. That can be caused by tightness on the front side, the hip flexors and the quads. So if you're a really quad dominant person, maybe you're a hockey player. Hockey players, as an example, tend to be really tight on the front side. Those muscles can pull the pelvis forward, and your hamstrings get tight because they counteract that. Another example would be for those of us who are hypermobile. So if you know you can squat down and almost touch your butt to the floor, or when you go to get into a plank position, your elbows are almost hyperextend, or maybe you even are double jointed. For those of us who are hypermobile and we have weak glutes and weak anterior core, so on the front side, it's really easy for our pelvis to get pulled into this position, whether it's inside or outside the gym. We chose two movements as examples of where this commonly happens, the deadlift and the squat. So if you're going to do a squat and you're weak in these muscles and you don't know how to recruit them, oftentimes we'll see the squat initiate with the hips going back, and this really big flare coming into the mid to lower back. Now, I'm not hypermobile, so I can't do it, I can't exaggerate it as much as we might see for someone who is hypermobile, but we get this really big overarch in the lower back, where those of us who aren't hypermobile, we generally have to avoid one of these positions where the pelvis tucks under. For the hypermobile person, we need to avoid too much of this. Now, in order to correct for that, there's a few things we can do. Number one, we need to essentially relearn how we move and become more aware of how we're positioned when we move. So simply retraining ourselves during those movements, so retraining with an empty barbell, or retraining with really light weight, working with a coach to do that. Let's say you get into class and there's squats in the workout or deadlifts, perfect opportunity to start training our movement patterns so that we're more neutral as opposed to tilted forward. Number two is learning how to recruit our midline, recruit our core to stabilize that position. Now, you just might not know how to engage, you might be strong enough in that area, but we need to teach you, okay, here's how you stabilize, here's how you engage at the start and through the movement. And that's where, again, working with one of us to help show you that and teach you that would be valuable. For those of you who are tight in the hip flexors and the quads, we need to address that, whether that's through techniques like foam rolling or static stretching or dynamic stretching, or maybe seeing someone who does soft tissue treatment like a PT or a massage therapist, getting some work done there to help lengthen that tissue so that it's not pulling on those hamstrings as much. The last part, strengthening the glutes and the core. So let's say we've learned the positioning, we've corrected the positioning. If we don't make those muscles that are weaker, if we don't make them stronger, just as soon as we've corrected for it, once we start adding weight or adding intensity or adding fatigue, we're going to revert back to what we had done before. So we want to make these muscles stronger, the glutes and the core. I'm going to show you two movements that can help with each of these. We tend to use one or two glute exercises in the lower accessory programming, and we always program core or midline accessory work each time we cycle through the accessory and mobility work. So for the glute bridge, you can start down on the ground, facing towards the ceiling, tucking your feet back towards your hips. And from here, you're gonna lift your hips up without creating much of an arch in your back. We don't wanna over-arch. We wanna keep this nice and neutral and squeeze our glutes. Let's say you can hold that for 60 or 90 seconds and it doesn't feel like much here. Then what you can work on doing is you can work on lifting one leg up off the floor and holding that position. You'll feel that build up in the plant leg. Now when you do that, just make sure that hip, so if I'm lifting my left leg up, that side doesn't dip down, all right? I wanna keep it nice and square to the floor. And we can work on that static hold, again, building towards 60 or 90 seconds. The other option is the single leg hip thrust. So we can take that static hold and make it a little more dynamic. So we get up against the bench, we rest our shoulder blades here, our feet are out in front. We push through our heels and lift our hips. Just like we talked about on the ground, I'm not flaring out my back. I'm squeezing my glutes. I go back down and I come back up. If that's feeling easy, I can go to a single leg option where I push through my heel with the bottom leg. And again, I can feel that building up down in here. So that's for our glutes. Next, for the core, we can perform dead bugs. So on the dead bug, we keep our shoulder blades off the ground, the lower back in contact. I'm gonna reach my right hand back and my left leg forward without letting my shoulders drop. And I really have to concentrate on holding that position and not letting my lower back flare and not letting my shoulders drop. The last one, we're going to focus on engaging the deeper musculature in the anterior core. So that's called the transverse abdominis. This is upper layer. It's called the rectus abdominis, and that dead bug helped with that. The deeper layer, though, is going to help hold things in place. So we're going to get into this tabletop position. Elbows out in front of the shoulders, knees behind the hips, laces towards the ground. And then what I'm gonna do is I'm gonna breathe out. And when I breathe out, I'm gonna pull my belly button towards my spine and hold it there. I'll keep it there as I take a breath in. I don't want my belly button to drop. And then when I go to exhale, I'm pulling it in even further. Don't let it drop. Take that breath in, pull it in even further, closer to your spine. We're gonna do about 5 to 8 reps of that. And you'll notice how I'm starting to shake. That transverse abdominis is really working hard to stay in place. And that's going to be really valuable for females who have given birth. That's a muscle that tends to be weakened during pregnancy and after birth. So that will help those ladies who have had some children. And it really helps anyone. Most of us struggle with strength in that transverse abdominis. So, going back to the board, we gave a little overview of that neurological side of things, body acting as a protective mechanism. From there, we went back to that anterior pelvic tilt for those of us who are really tight on the front side and or are really hypermobile. Again, deadlifts and squats, some common movements where that happens. So, if you have pain during these movements, you know that one of these things is going on. Yes, it could be something else, but a lot of times we've come across some people or some members, I should say, that correcting this has solved those issues. So, if you feel like you fall into that category, see one of the coaches, talk to us, let us watch some of your movements, give you some feedback, assign some work to do for corrective work, both positional and strength work, and maybe even some flexibility work. Address it, work on it, and again, you'll notice some progress as you do that consistently.